Welcome to Game 8. This session will include both a slide as well as a specimen. The specimen is small and it can be a little embarrassing because it is difficult for us students to explain a small specimen. But we shall solve the problem. First, let us go on to the slide. Now I am seeing a circular structure along with a whitish space called the lumen. Always it is advisable to look at the slide with the naked eye. What are all the small structures that can have a lumen? It can be an appendix, a fallopian tube, a small blood vessel, or a ureter. Of these, appendix is commonly kept for the student. So let us assume that on seeing this itself, the diagnosis is appendicitis. And there can be some large structures like a large blood vessel or esophagus, but then they will not be fitting into the slide. You will not be able to see the lumen. So that is a trick of the trade. So this is an actual photo of the appendix, a cross section. This is the histology which you people would have mastered in your first year. There is a mucosa that is thrown into folds and there is a muscular layer over here, very important. This is called the serosa, that is external. This is a counterpart in the H&E stain. I find that there are large lymphoid follicles. These are all lymphoid follicles and this is the normal mucosa. This is the lumen and again the muscular layer, the inner circular, outer longitudinal, and there is a serosa. So this is the structure of the appendix. Now what happens in a case of appendicitis? Appendicitis is an inflammation of the appendix. So I find, what is this SL? A stellate lumen, a star-shaped lumen which I can identify. The other things I have mentioned. In a case of appendicitis, why is it called acute? Because it is of a short duration, severe, and it is infiltrated with neutrophils. So N is the neutrophil, and here I find spindle-shaped cells that indicate the smooth muscle. How do I say that it is the neutrophil? I find these are all the nuclei, not at all the cytoplasm. All the blue colored structures are the nuclei, and look at each one of them, they are having an irregular nucleus, and hence I say it is neutrophil. So it is neutrophil infiltrating the muscular layer. This is mandatory for a diagnosis. And this structure shows a large area, an extensive area of ulceration. This is an important diagram. In fact, this will be kept in the slide for you, exactly focused. I am finding the mucosa. These are the mucus glands with goblet cells. There is an area of ulcer where I am not seeing the mucosa at all. Area of ulceration. And the neutrophils are involving the entire thickness of the section. And they are infiltrating the muscle also. And here it is the lumen that is also showing an inflammatory exudate. So these are the features. I am repeating: mucosa with ulceration, neutrophils extending into the muscular layer, and the exudate spilling over into the lumen. And this particular slide is also important. I find that this is the external surface, and in the cut surface there is a thickening of the wall that can be seen and narrowing of the lumen. So what are the points in favor? What all should you people write? Stellate lumen, presence of lymphoid follicles, mucus glands with goblet cells. There is ulceration, as I had pointed out earlier. Luminal exudate. This is a lumen with the exudate. Transmural. Transmural means across the entire thickness, infiltrating into the muscular layer. And that is what we people see. Sometimes it can spill over into the serosa, into the mesoappendix also. And if it is ignored, it will lead to perforation. This is a structure. A mounted specimen can be kept for you for description or for diagnosis. And look at this one. I am finding a finger-like structure that is a little ballooned out because of the edema. So there is an edema or swelling of the appendix. And it is open at one end. They have closed it after surgery. And this one end, you find that there is a blunt end over here. And there is a creamy exudate indicating inflammation. A creamy exudate that is present on the serosal surface. And here again, I am finding some worm-like structures which are the congested blood vessels. So when you want to describe a specimen, you are supposed to describe it like this. It is a linear, small, finger-like specimen, open at one end, measuring so many centimeters long. The external surface is grayish brown. It is congested with distended blood vessels. There are gray-white patches of exudate. There is edema and thickening of the walls, and there is narrowing of the lumen. Compare it with the normal appendix, this is somewhere huge. And all the features that we had mentioned are seen over here. What can be the cause of an appendicitis? It can be because of some obstruction. After all, it is a rudimentary structure that is protruding. So whenever there is a stone, a fecalith or so, it leads to stasis, there will be infection, there will be inflammation, and also there can be more of edema which will lead to obstruction of the lumen, leading to further inflammation. Our next topic shall be leiomyoma and teratoma. See you in game 9.